What is avoidance behavior, and how do you overcome it in CBT? Imagine facing a situation that makes you anxious or uncomfortable, but instead of dealing with it, you find ways to avoid it completely. That's what avoidance behavior is. It's when you do things to steer clear of stress, fears, or difficult feelings. Sometimes you're aware of it, and sometimes it happens without you realizing. This kind of behavior might seem helpful at first, but it often keeps problems going or even makes them worse. There are different types of avoidance behavior. Behavioral avoidance is avoiding specific places or activities. Cognitive avoidance is when you distract yourself mentally, like pushing away upsetting thoughts. Emotional avoidance involves avoiding feelings like sadness or anger. Interpersonal avoidance means steering clear of social situations or conversations. All these forms serve as quick escapes from discomfort, but they stop you from facing what's really bothering you. Even though avoidance might give you temporary relief, it can lead to bigger issues over time. It can cause social isolation, increase anxiety, or deepen depression. When it comes to anxiety disorders, avoiding feared situations keeps the fear alive. You never get the chance to see that you can handle those situations, so the fear stays strong. That's where cognitive behavioral therapy, or CBT, comes in. It's a proven way to help you overcome avoidance behaviors. The first step is learning to recognize what you're avoiding and what triggers these actions. Once you see the pattern, you can start setting small, clear goals to face those fears gradually. For example, if you avoid social gatherings, your goal might be to attend a short event with a friend. Another key part of CBT is exposure therapy. This involves slowly and safely exposing yourself to the situation you fear. Over time, repeated exposure helps reduce the fear and anxiety connected to it. For example, if you're afraid of public speaking, you might start by speaking in front of a mirror, then to a small group, and eventually to larger audiences. Behavioral activation is also useful, especially if depression is involved. It encourages you to re-engage in activities you've been avoiding, helping to lift your mood and build confidence. Mindfulness and acceptance techniques teach you to tolerate uncomfortable feelings instead of running from them. These skills help you stay present and less reactive to distress. In cognitive therapy, setting behavioral goals is essential. You learn to notice when you're avoiding and understand why. Then, you create realistic, manageable steps to confront those situations or thoughts. It's about finding a balance, pushing yourself just enough to grow without feeling overwhelmed. Over time, these small wins add up, making you more comfortable with facing life's challenges. By practicing these strategies, you can break the cycle of avoidance and develop healthier ways to cope. Facing fears gradually helps you regain control and build resilience. Remember, overcoming avoidance isn't about forcing yourself into everything at once. It's about taking steady, intentional steps toward facing what you've been avoiding.